Hello, everyone. It's another Wednesday, a day with your fertility specialist. I am excited to be your host, Ruth Ogogo, and it's always a pleasure to have you, our dear viewers, with us every Wednesday. On behalf of Alps Hospitals, I'd love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying tuned to our live sessions and all our posts on our social media handles. As we get started, call up someone, share this link with someone. Like I would always say, if you need to send data to someone just to make sure they're able to join this chat right now, please do that so that they're able to gain as much insight as you'll be getting. And today we're talking about PCOS and fertility. Wow, PCOS. And guess who we have with us? Yeah, the star for the day or the star for every day. Dr. Kenneth Eguda. Dr. Kenneth Eguda, for someone watching for the first time, Dr. Kenneth Eguda is a consultant gynecologist. He's an IVF specialist, he's a fertility specialist as well, a minimal access surgeon, and a lot more. But that's not why we're here today. So let's keep a lot of all that. But just for you to have a little knowledge of who will be giving you insights into today's talk. We're talking about PCOS and fertility. Dr. Ken, it's always a pleasure to have you with us. Thank you for joining us today. Oh yeah. So viewers, please feel free to drop your thoughts, your comments, your questions in the comment section. We'll definitely attend to them appropriately. As we get started once again, share this link with someone. I'm talking to you right now. That is not wanting to share. Please share the link and stay tuned. So, Dr. Ken, we're talking about PCOS. PCOS seems to be really common. As a matter of fact, when I was checking the statistics online, it was showing that 1 out of every infertile woman, 1 out of 6 of them is a candidate to having PCOS. And I'm like, wow, 1 out of 6, that's not far anymore. So it seems to be really common. What's this PCOS we're talking about?
Yeah, PCOS, it's a very interesting topic. And for me, it's a very scary condition. Yeah, not every variant of PCOS is scary, but it's always a worrisome condition for a gynecologist who specializes in fertility medicine or reproductive endocrinology, because you get to deal with them one way or the other. Either when they are trying to achieve pregnancy or having hormonal abnormality with amenorrhea, as in that's not having to menstruate every month, or having problem with weight. On rare occasions, having some weak syndromes like diabetes, hypertension, and some other endocrine abnormalities. So PCOS or PCOD, or what the lay people say PCOS, just means polycystic ovary disease, or polycystic ovary syndrome. Polycystic ovaries. It's a syndrome when you have all the metabolic or some of the metabolic abnormalities together with infertility, associated with polycystic ovary. And it becomes a problem when a woman notices abnormalities with her, either difficulty with conception or having excessive hair distribution in the body and need to have them waxed off, or having problem with menstruation. And then it's actually a syndrome that has to do with a woman now in the reproductive age not menstruating every month. Yeah, and because she's not menstruating every month, she's not ovulating. And then she may have some laboratory evidence of hormone abnormalities. And then what I observe with most women who say, the doctors say, I have hormone imbalance. That's African language or Nigerian language.
Yeah.
They say, okay, I went to see my doctor, and my doctor say I have hormone imbalance.
Yes, I see
Hormone
that a lot
imbalance. So
online.
you see a lot of women saying hormone imbalance. And now, one of the commonest form of their hormone imbalance is maybe you have a change in the ratio of the luteinizing hormone to the follicle stimulating hormone, and often you have elevated prolactin. A good number of women with elevated prolactin actually have a polycystic ovary.
Wow.
And then some other women have elevated anti-Mullerian hormone. You see a young lady or an advanced age lady having a very elevated anti-Mullerian hormone.
Wow.
All of these are pointers to polycystic ovary. So it's a constellation of symptoms and abnormalities, or call it syndrome, where a woman has problem with menstruation.
Wow.
Often they go 2 to 3 months, sometimes 6 months, and occasionally even a year without seeing the menses in their reproductive years. There are other things that could make women not have their menstruation, okay? But PCO is just one very common one. Then they have lack of ovulation. They don't ovulate.
Wow.
And then they have hormone abnormalities. And then they have elevated level of anti-Mullerian hormone, which erroneously shows that they have good number of eggs, probably better quality of eggs. That's why I call it erroneously.
Yeah.
It's meant to typify that, but it is in the negative with respect to PCO.
Wow.
Yeah, so that's what PCO is. It's a very worrying condition. And now you see from your statistics, 1 in 6 women have a PCO, polycystic ovaries. And then we're seeing that the frequency is a lot more now than it used to be. Of course, because of lifestyle changes, westernized lifestyle changes. And then it's good to mention at this point that India to be the epicenter for PCO.
Wow. Okay.
That's the headquarter of PCO.
Yeah.
Just like Africa, Nigeria is the headquarter for sickle cell disease.
Wow.
And some other diseases.
Okay, I don't want to say what's on my mind right now. Okay, maybe I should say I was just thinking of poverty in Africa.
No, but then poverty is actually very central. Sorry for the distraction. It's just that when you know so many things, everything makes sense to you. Poverty it's one of the common causes of a lot of abnormalities, including infertility.
Dr. Ken.
and then if yes, it can actually accentuate the manifestation of PCO, because if you have lack of money, you tend to eat a lot of kind of things, because management of PCO has to do with diet.
Wow.
So when you don't have the money, it makes management of PCO difficult too. Yeah, poverty is just is a cause of a lot of things. In medicine, for instance, as a medical student so many years back, almost all diseases, in the books we read, had poverty as a cause, as one of the causes. For instance, cancer of the ovaries, cancer of the cervix. Poverty is one of the causes of cancer of the cervix, or it's a risk factor for cancer of the cervix. So many things.
Poverty,
that's poverty.
Let's hope one day Nigeria comes out of poverty. Oh yeah, so dear viewers, you see, there's just a lot, and that's why we've actually called in Dr. Ken to give us so much insight, because Dr. Ken is one of a kind. When I say one of a kind, he's one of a kind. He's type. There's just him in the world. Just so you know.
Few of us, you mean?
Well, there's just Dr. Ken.
Oh dear.
This is him just trying to be humble, but really there's just Dr. Ken. For someone watching, so there's just a lot about PCOS, and that's why we have Dr. Ken. He knows, and he's really going to give us insight. So I really want someone to be very attentive to this session today, so you're also able to reach out to as many that might not be able to join on this link, and they are able to find help on time, just in case they might be suffering from it and they are not aware. So I was also going to ask, okay, are there degrees to PCOS, or is there a grading for it, or does it differ, or if you just have PCOS, that's just it?
Yeah, like some 10 years back, PCO was just PCO. But science is always advancing, and details, attention to detail is being paid in science. And then we begin to see that there's a woman with PCO that has everything going easy and smooth with her, and there is another woman with PCO who has like the whole hell been loose, unleashed on her. Why one woman is having fertility easy, having menstruation every month, just having only signs of PCO, but then having pregnancy, giving birth to our babies, and all of
Yeah.
that. We have some others who have lots of problems, infertility, no menstruation, and all of that. So that typically tells you there is some degree of differences with
Okay.
with PCO,
Okay.
So, and then for the purpose of just understanding, well, this is already how do I put it now? It's already established. There are four degrees
Okay.
of PCO. Some people call it the phenotypes of PCO.
Okay.
You have a phenotype A, phenotype B, C, and D. A is milder, D is
Very
bad,
severe.
is more severe. So, and then based on symptomatology and ease of getting pregnant, A, B are a lot easy. Then C, D are a lot difficult, and then PCO is genetically determined.
Okay.
Yes,
Wow.
because mothers transmit these genetic conditions to their babies, to their daughters. Then manifestation now depends on type of these kids. And then you see that mothers previously eat healthy. I mean, back in those days,
Yeah.
they eat healthy, and eat healthier, are more physical. Do a lot of exercises, and then the diets are usually the traditional or local diets, and so they had quite a number of things going smoothly with them, and then conception and delivery may also go easy with them. But you see, the diet these days is a lot modified, a lot polished, westernized, and and even kids are becoming too sedentary. They like pleasure, the ice cream, the meat pie, and the pastries, and all of that.
What they call
And all of
enjoyment.
these, trigger the metabolic abnormalities that affect or worsen the expression of the endocrine system. And so it makes the manifestation of PCO a lot earlier and more aggressive, than what we're seeing today. Okay, I've seen a grandmother
Okay.
having a daughter who is PCO,
Wow.
and now having a grandchild who is also PCO. Generation of people. Now the grandmother had her kids. She had PCO, but she had her kids so easily. Then the daughter had difficulty, and now the grandchild is already manifesting signs of PCO
Wow.
at a very young age, not yet married. So this is a generation of PCO in a family, but
Yeah.
all coming with different symptomatology and aggressiveness. So you see, so PCO is in grades: phenotype A, phenotype B, C, and D, or call it grade A, B, C, D, or grade 1, 2, 3, 4.
Oh.
Grade 1 and 2
Mild form.
manageable, 3, 4 really, really abnormal.
Wow.
And then from the reproductive aspect, for instance, we've seen PCO ladies who just conceive without needing help. And then they have all their kids in quick succession without needing much intervention. Then you have some that
They
with
will
all
need
the
help.
things they express will almost be impossible for them to get pregnant using their own eggs or their oocytes. A good number of them are better off achieving pregnancy with donated eggs,
Wow.
because the problem with PCO goes deep to the level of abnormalities with egg development, with oogenesis.
Wow.
So depending on the grade and the lifestyle,
Yeah.
PCO could come easy, and
Wow.
it could go very difficult for some people with respect to reproduction.
Yeah.
So they are in grades.
Oh, dear viewers, so you see that we're also getting to know that PCO can be in different grades. So, speaking of which, you were also talking about some factors that could predispose one. What are some of the things that people do that maybe they already have it in their gene that could predispose them to start manifesting symptoms and all?
Yeah, excessive weight gain, for instance,
Okay.
it's one of those things that could make PCO difficult
Okay.
to care for, and that is why, as part of the treatment for PCO, you encourage the women to shed weight.
Oh,
To
wow.
shed weight. Yeah. Yeah, because when they lose the weight, it helps in a lot of correction of the metabolic abnormalities,
Yeah.
helping in putting the hormone profile or the hormone axis in a better uh, perspective for egg development, ovulation, and quality of eggs.
Yeah.
So then eating right at the same time. For instance, the PCO guys have a lot of estrogens. Estrogen is usually higher than the
Wow.
normal level of estrogen in
Okay.
population of women.
Wow.
And if you know something about PCO, I mean about estrogen, when estrogen is high, the body shuts down the process of ovulation because it deceives the brain as if ovulation has occurred already, so the brain
Oh,
just chills. And
wow.
it's this estrogen actually that keeps the lining of the womb from shedding. So they stay a very long time without
Missing the
menstruating.
period. Wow.
You understand? And if you eat food that have lots of estrogen, what are you doing as an individual with PCO? It get worse. And now this is for Nigerian population.
Yeah.
There are some food with abnormal estrogen in Africa, for instance, in
Okay.
Nigeria, yeah, like the dairy. I mean the poultry feeds, for instance, the
Okay.
poultry products
Yeah.
like eggs, the chicken, because they are fed with estrogen-like materials, and that is why they
Wow.
grow so quick and so fast within 4 to 6 weeks, and they are ready for consumption. So you can tell what happens if you have a kid eating all of
Of
this
this.
stuff. So and then you have the gene for PCO. So you easily walk yourself up to having the PCO. Then of course all the pastries that kids eat a lot, worsen it, call it the meat pie, the burger, the
Wow.
pizza, and all of that. They're all carbohydrates. You understand? And so they make for weight gain and all of that. So those are the risk factors, and basically the sedentary lifestyle too. So people just like enjoyment, and PCO doesn't go with this kind of ignorant pleasure. It
Wow.
worsens PCO. I'm not saying enjoyment is bad, but you have to redefine the diet and the lifestyle for pleasure. If you do a lot of vegetables, for instance, a lot of grains, healthy grains,
Yeah.
healthy meats, or even the fish or some seafood, you will be better off, and a lot of physical activities. So yeah, the population of PCO is very high now.
Wow, viewers. So you see, for someone watching, what we tag enjoyment sometimes is not
No,
it's
it's
not as it
not.
seems. So you see, you can't just yeah, I'm sure you're also taking a lot of points down because there's just a lot that I know that after hearing today, you definitely work on and be a better version of you. Okay, so now with relation to fertility,
Yeah.
how does PCOS impact fertility?
Now, I mean, the doctors will say this better, or those all the doctors involved in the care of a patient or client with PCO.
Yeah.
You know, the PCO, because of the abnormalities with the hormones, one, they
Yeah.
have problems with producing eggs. And that's to say,
Wow.
some on their own won't produce eggs. And if you don't produce egg on your own, it means you will not get pregnant
Pregnant.
all by yourself.
Wow.
Because I mentioned earlier, they have problems with ovulation. And in a lot of instances where they ovulate, the quality of the eggs they ovulate is poor.
Oh, wow.
And so, what do you expect with poor eggs? Poor pregnancy
Pregnancy.
outcome.
Yeah.
And then in good number of cases, okay, tell a woman who doesn't menstruate for 6 months, have a lot of estrogen in her system, when is ovulation going to happen? So the body just work just in a very abnormal way.
Wow.
You understand? So a good number of them would either have poor pregnancy outcome or no pregnancy at all, and some have no prospect of getting pregnant without aid. And some have a lot of eggs. Yeah, the truth is that they have more eggs than the general population. Yes.
Okay.
Yes. At every point, you make demands on their body to produce egg by giving medication. Those with PCO show better prospects.
Wow.
But now the quality of what you get from them may just be a problem
Question.
if you don't aid them. And so because of all of that, pregnancy chances are very, very low. And then, but some actually get pregnant all by themselves, unaided, without complications.
Okay.
But a good number of them have just problems with pregnancy processes. So the pregnancy prospects is poorer for population with PCO than those without PCO.
Okay. And
Yeah.
then when they're pregnant, how
Yeah, when they're pregnant, because it's a metabolic condition,
yeah.
one, they have lots easy or frequent pregnancy losses.
Wow.
Yes. Sometimes people just say they have pregnancy losses, and the doctor tells them there is no reason for that. Sometimes it could be PCO, abnormal eggs. And then because they have abnormal eggs, the body doesn't support the pregnancy so
Pregnancy.
easily because you see the follicle, which is like the case where the eggs is ovulated from,
Yeah.
depending on the size of the follicle and the health of the follicle, a pregnancy can either get good support
Yeah.
to go through the first 3 months or poor support. And then for a good number of guys with PCO, ladies with PCO, there is a problem with their luteal cyst. The luteal cyst is the case where ovulation happens and then it supports pregnancy afterwards. So because they have poor luteal cysts, sometimes there's poor hormone support for the pregnancy and pregnancy may just go bad. So they usually need to be under the care of the gynecologist when they're pregnant to give the hormone support and
Yeah.
of course hope that the egg was good enough to take pregnancy to a logical end. Going to second trimester of pregnancy, for instance, there are tricks of having a hypertensive disorders of
Oh wow.
pregnancy, and a good number of them may even have a sugar abnormality, that's gestational diabetes,
Okay.
in pregnancy
Wow.
and all of that. And this affects the health of the baby they're carrying and the outcome of the pregnancy. And then the
Wow.
kids they are giving birth to will also eventually may be subject to the same
Coming down with
when
it.
they grow up. Because one, they're born in that condition, then they also could be having genetic condition. I'm talking about the
Conditions.
females that may be given birth to by those means. So pregnancy prospect generally it's a little bit
Dicey for them.
yeah, dicey, and uncertain. And uncertain.
Wow.
And it's a cause of recurrent miscarriage.
Miscarriages. Wow.
Yeah, for some people, is one of the common cause of recurrent miscarriage.
Miscarriage.
And then you see some individuals, for instance, maybe doctors, treat women with polycystic ovary, and they
Yes.
retrieve a good number of eggs, and then they are rejoicing. Hey, she has a lot of eggs, or she's responding so many with so many follicles. Usually, if you know what you're doing, you have no reason to be so happy. You just keep fingers crossed and hope that this number of eggs will translate to something good. And then you do treatment and they don't succeed, and you're wondering how come they do not
They
succeed. We don't know what went wrong. We know a lot. It was never right from the beginning, and so the outcome is just a very dicey
Dicey one.
outcome,
Wow.
just that's just it. And then if they are monitored closely,
Yeah.
things could actually go. And that is why you see when you're treating the guys with PCO, you need to first of all understand the deficiency their body has. They're deficient usually in homocysteine, and in vitamin D3, the manganese, the selenium, the zinc. So you want to try to optimize the background under which these eggs are going to be produced. The coenzyme Q10, for instance, help in strengthening the mitochondrion because the mitochondrion of the oocyte is one of the most important thing about the eggs. The guys with PCO have poor. So you have to try to strengthen all of that so that you increase the chances of producing good eggs. Then you take it up from there. So all of this needs to be done. And then there are guys who are specialists in stimulating those PCO. But then depending on the grade, there are sometimes no matter what you do, you just have a very poor response. Occasionally, they have this conditions where we have empty follicle syndrome.
Wow.
Yes, empty follicle syndrome. Polycystic ovary is one of the causes of empty follicle syndrome. So you stimulate a woman, for instance. I mean, you give medication for ovulation, either for
Yeah.
IVF or IUI, and then maybe you go to retrieve the eggs in case of IVF now, and then you find out that all the follicles have no eggs
Wow.
because there's always a problem with PCO. So
Mm.
you are never really very sure what the
To
PCO outcome
expect.
is going to be, So they can have empty follicle syndrome where you have a lot of
Wow.
follicles but no eggs
No
in them.
eggs. Wow.
And then what do you expect? No
No
pregnancy.
pregnancies. Yeah.
And then you may, from our own experience, a good number of them do better with egg donation. Because you
Wow.
keep stimulating, they produce good number of eggs, no pregnancy. Sometimes you stimulate, they produce no eggs. Sometimes few eggs, no pregnancy. So we in our facility, for instance,
Okay.
place them on all these supplements to try to improve on the
Chances.
the surrounding, I mean, within the body where the eggs are going to be produced. Then, of course, we tend to do what do you call this polycystic, laparoscopic ovarian drilling if the woman is qualified for laparoscopic ovarian
Ovarian
drilling.
drilling.
And the reason for this is that you burn down the stroma
Okay.
of the ovaries because they have dense stromas, and these stromas actually make the ovary operate as if it is aging. Because you see, an aging ovary, for instance, an ovary of a woman close to menopause or at menopause, is full of fibrous tissues. And then that's the one common thing you find in ovaries of women with
PCOS.
polycystic ovary. So when you do that drilling with a source of energy, it burns down the stroma and all of that and improve on the hormone abnormalities. Then for some people, this helps them to produce good eggs without medication. This helps them to have easy pregnancy without complication. And for those who have indications for IVF, for instance, it makes them produce a better quality of
Quality of
eggs
eggs.
that may improve on the chances for IVF. And then you could do all of this, and even with IVF, they don't achieve pregnancy because the reason is this: egg is just one factor in IVF. The endometrium is another factor in IVF. You could
Yeah.
have the golden embryos from a PCO, but if the endometrium is not okay, pregnancy may not happen. Then you could have all of that worked out in a woman, and then the husband, the partner's sperms is not very great. Pregnancy could also not happen. But you just do everything to optimize the chances of getting pregnant. So the prospects are actually very dicey, but they get pregnant,
Well, I know you've
especially with egg donation. It's easy.
yes. So speaking of the procedure you just talked about, what are various ways that people with PCOS could actually manage the condition PCOS, and are there fertility counsels that you give to people with PCOS to with regards to outcome in pregnancies and all?
Yeah, I've mentioned some of them.
Yes, yes,
Sometimes when you're pregnant and you're not aware of what the prospect of the pregnancy is,
yes.
if you have a pregnancy loss, it hurts you more than anything else. But if you know what PCO entails and know that the prospect for pregnancy may not be very great, if the unavoidable happens, it's easier because the doctor has counseled with you, has
Yes,
informed you that this
yeah,
chances is low and all
and
of that.
all, yeah.
Okay, so I think they need to understand this and try to be as close as possible to a gynecologist who understands what PCO is
PCOS.
to give you individualized care. And now the care for one client with PCO may be different from another client with PCO because it's a metabolic condition to an extent, and then everybody has its own metabolic peculiarities. A woman who is overweight for already will be sent to the gym on a special diet regimen, and maybe different kind of medication,
Yeah,
which is also based on the hormone abnormality she
she
has
has.
to do her life. While another person with PCO, for instance, may not have that regimen. So you need an individualized care, which is based on your peculiarity. If you need to be on medications, you'll be placed on medication. If you need lifestyle modification, you would be made to have lifestyle modification. And if you need to have egg donation outrightly, you will be told you need egg donation outrightly, but you need a reproductive physician or gynecologist who really understands what PCO is to really guide you through the prospect of pregnancy. There are some of the ovaries you see on ultrasound scan, for instance, and you know it, that this ovary with what I'm seeing may not generate eggs. So you counsel the woman and save her the problem of waiting all by herself, because she may just not get pregnant all by herself.
Yeah.
It sounds very harsh, but that's the
It's
way to
what
go
it
about
is.
it.
I actually, now you're speaking of egg donation. I know of someone that I think her first visit to the hospital, they had told her she had PCOS and she was 33. And then she said, okay, you're young. Maybe if you want to give it a try, you could, but this is what it is. Your chances are lesser with regards to pregnancy. And she was like, she has tried getting pregnant for 3 years. She's done waiting. If she's not sure she's going to get pregnant with her egg, she just went straight up for egg donation. And today she has given birth to twins. And we were like,
You know,
lucky her.
when you get to egg donations, the society finds it very disturbing to hear the word egg donation, you know. But I think it's because of ignorance of what the human body is capable of doing. That is why I love the UK, for instance. You know, the UK right now, there's a program going on in the UK when a girl is born,
Okay.
a female is born, a real genetic female.
Yeah.
You know, she's been profiled to see how long her ovaries can produce eggs.
Wow.
And then she'll be given a personalized counsel on what to do with her fertility life.
Yeah.
If she wants to have kids quick, if she wants to have egg frozen and all of that, she decide how she wants to go about it, you know, so they know what to expect. It wasn't too long I saw a lady, you know, early 30s or just 30s. She started off life with symptoms of PCO. You know, amenorrhea, go 2 to 3 months, no menses. Somewhere in between, she got pregnant. But now the symptoms now changed, you know, to 6 months, no pregnancy.
No period.
But this time around, it was associated with hot flushes.
Wow.
So it means that she probably had PCO. I didn't evaluate her early, but her symptoms were symptoms suggestive of PCO because she even got pregnant. Then now she's manifesting with symptoms of ovarian exhaustion
My
at
goodness.
30. You know,
Wow.
that is premature ovarian failure or insufficiency. You know, and then I had to tell her that, then look at the hormone profile. The hormone profile were hormone profile of a menopausal woman.
Wow.
So this is
my goodness.
probably having PCO early in life.
Yeah.
Then now accelerated ovarian failure
goodness.
at 30.
Wow.
And then she had seen quite a number of gynecologists, and all they were concerned about is making her menstruate. And by the way, let me just stop here for a while. What attachment do women really have with menstruation? You know, yeah, to be very candid with you, women are so addicted to menses that even when the menses is disturbing them, they like seeing them.
Because you know they actually well, I'm a woman, maybe I should speak for them.
Let me make my point clear before you speak in defense of women. You see, so and in sympathy, doctors also treat them that way. A woman comes to you as a doctor and she says she's not seeing menses anymore, and all you're careful about is making her see the menses. Of what use is it? First of all, understand why she's not menstruating. You know, all you need to just understand human endocrinologies of reproduction. And then these ladies' hormones were all everywhere. Oh man, I see you have ovarian failure. Yeah, of course, not happy saying that, but that's what it is. You know, and then she felt like now the puzzle is making sense. It's tying up. And this is exactly what she had. So making women menstruate doesn't mean anything. Understand why they are not menstruating and tell them what they need to know or what they need to understand about themselves. Because if your ovaries have failed already or they are out of use or function, what use is menstruation? If she needs to be pregnant, tell her the way to go. You know, so you don't just come to consult the gynecologist and all he cares about doing is making you menstruate to spend more money buying sanitary pads or towels or something. So yeah, one of my professors in the United Kingdom once said that the menses is the genesis of every woman's problem. If the menses is scanty, it's a problem. If it is excessive, it's a problem. If it doesn't come, it's a problem. If it stops coming, it's a problem.
Oh my goodness.
What kind
Every
of clock
woman
is
feels
that?
like when she's menstruating, she has the potential to be pregnant. so,
Exactly. Some feel
so
that,
that's the
oh
notion that most
yeah,
women
that's
have.
okay. I get that. I get
So that's
that.
why they're always craving for the period because
Yeah.
they feel like if they're not seeing period, that means the likelihood of getting pregnant is
But the mistake they make is this.
mm,
I actually I didn't tie this up. I see a lot of women too in my consulting room, and then um, you evaluate them and you tell them that, Madam, I don't think you have good enough eggs to have pregnancy, and she goes, but
seeing my
I'm
period.
still seeing my period. I'm still menstruating. I say, okay, now we need to do some education here.
Mm,
Now a good number of women can be menstruating for 10 years without having eggs or
X.
good
Wow.
eggs. That's the
Wow.
truth. You see, that is why the regular tests that women do, FSH, follicle stimulating hormone, and
Yes.
LH, luteinizing hormone, to tell. And doctors, when I mean for some
Irregular.
categories of doctor, when you have that normal, you say, oh, okay, you're ovulating. Who says that means ovulation? Because you see, a woman can be out of eggs, and the FSH and LH is still normal for 5 to 7 years.
Wow.
And that is why the sensitivity and specificity of LH and FSH telling about menstruation is very, very low. I mean, about ovulation. So the
Yeah.
only thing that tells whether you have some eggs left is the AMH, anti-Mullerian hormone, and the antral follicle count.
Count.
Those are the things that tell. So when women come say, okay, if you say I'm not menstruating, what's the menses all about? If I'm not ovulating, what's the
Yes,
menses all about?
exactly.
I say, okay, sometimes we don't have time to educate you this way, but
Yeah.
this is the reality. So they should stop. And then some doctors feel when they induce menses, ovulation
Ovulation
happens.
happen.
That's also not true. When there is no menses, there's just something happening.
Okay, so well, viewers, you see that there's just a lot about PCOS and its symptoms, and you might just think you're free, and then you just get to the hospital one day, and boom, they're showing you some results, and like, where is this coming from? So we have someone asking. This is Grace Udo. How can one know they have PCOS?
All right. So I think basically sometimes you have PCOS and you don't know you have PCOS all by
PCOS.
yourself because you're not showing symptoms. It's good to know that sometimes it's difficult for you as an individual to know that you have PCO. But the common signs of PCO, for those who manifest those signs, like a lack of menses. I
Okay.
mean, you go 1, 2 months or 3 months without menstruating. Then, because you don't menstruate, you don't ovulate. Then you have the problem with the hormones. The hormones are abnormal. Therefore, some people they have abnormal distribution of hairs,
Yes.
a lot of
Wow.
hairs in the body, like the male counterparts. Now the hairs may be in the legs, in the arms, or sometimes hair on the chest or
Oh
in the
wow.
abdomen. Then some
Below the
beards.
chin. Wow.
Now there are other conditions that could give you hairs that are not PCO,
Okay.
but
Okay.
this is one of the signs of PCO.
PCO.
So
Wow.
when you have all of this, then of course it could be. For some people, it's the frequent miscarriages
They have
that
it.
is a pointer that they have PCO, because
PCOS.
that means the doctor looks deep into you, do the hormone profiling, and do the ultrasound scan and begins to see the signs, the features of PCO in you. Yeah, and sometimes it just be some clinical conditions like diabetes,
So, dear viewers, that's why it's
acne, pimples. This thing we call pimples. Yeah,
yeah.
it's commoner with PCO guys too.
Wow. So that's why it's good that you don't just assume you're free of it. You could do a regular check just in case, just to be sure you're clear or not. And then Galvin, you asked the same questions about symptoms. I know he just talked about that. So maybe we'll take the next question. I believe your question has been answered. Rebecca is asking, okay, so she's just saying that yes, sir, this is to you, Dr. Ken, because you're our lecturer for today.
Yeah, I'm the lecturer.
So she said, yes, sir, I agree. I agree with you because her mom and her sister have PCO, but they gave birth successfully. But for her,
Exactly.
it's difficult after waiting for many years. She says she agrees with you, and it's just like you're talking about her case. So this is Rebecca. Well, we hope that you're able to achieve conception.
Oh
Ken,
yeah.
do you have a comment to Rebecca?
It's actually very emotional to see that someone is going through this,
Yeah.
because if you know what it takes to get pregnant and the trauma one goes through when he or she is not getting pregnant,
Pregnant.
you could understand what she's talking about. So I just wish that you have a good gynecologist you're seeing from wherever, and he has the capacity to give you all the care that you
Yeah, you
need.
need.
Talking about the lifestyle education, the interventions like the laparoscopic ovarian drilling or whatever kind of drilling it is, and then to give you the appropriate counseling. And also, I think your partner will need to be checked so that you're not dealing with multiple reasons for not
Reasons.
getting pregnant. You know, men actually are one of the highest reasons why women don't get pregnant these
Pregnant. Oh,
days,
wow.
and it's going to get worse.
Please increase the volume of the mic.
No, I won't increase it. Why are you trying to take advantage of me?
This is for the men. They need to hear this.
You know, this happened in the consulting room a lot of times. I know a couple come in for evaluation,
Yeah.
and then the sperms are poor, and of course, you don't know what they've been going through or what
Yeah.
level of fight they've been involved in before coming. I now tell the guy that this sperms is very low, and with this sperm, pregnancy may be very difficult. Say, please tell him. You know what's been happening in the
Yeah,
background,
exactly.
Yeah, so really, to be very candid with you, sperms are one of the reasons why a lot of people don't get pregnant. So
Wow.
the problem may be even be more than the problem of PCO.
PCO.
That's to be very candid with you. And knowing that you add ego to problem of sperms, it makes it very complicated. And sometimes the men also will say, okay, are you sure everything is okay with me? See, I've been telling her. But then we tell them it's not a blaming game.
Yeah.
It takes
it's not
two
their
to achieve
fault.
this success. So they should just partner well, encourage themselves. But of course, we see some very beautiful couple, and no matter what the problems is that you elaborate in the consulting room, they still hold themselves together and tell you that we are together in this, and that's
so
one of the
lovely.
beautiful pictures I like seeing in my consulting room.
Wow.
You are not passing the blame, yeah.
Okay, so Hawa is also saying she's been diagnosed with PCOS too. So we seem to have quite a number of viewers that are actually battling with PCOS. Well, we really hope that you're able to manage this condition well, and we also hope that you're also able to achieve your fertility dreams as you go through this journey of
last 2 years, last 2 years in Denmark, I had a meeting with some specialists, gynecological specialists in PCO from across the world, and then we got to talk about how different kind of PCOs have been managed, and then I was very impressed that in different regions of the world, there are something being done for the guys with PCO, and I just really wish I could have a dedicated clinic, where I see people with PCO, so let them know what their profiling is. And then we need to get to a point where we know the genetic locus and the kind of gene sequence that every PCO is, what makes PCO manifest differently for different people. And so maybe then we'll have the way to think of the care for the PCO guys, while we still work on the possibility of cure and avoidance of PCO, which definitely is coming very soon by the means of CRISPR. Because now with CRISPR technology in medicine, a lot of these diseases with abnormal genes are going to be cured, and maybe guys like me can be made to become hunks, with muscles and 6 or 8 packs. Because you see, there's a muscle controlling genes we call myostatin. For those of us that are not very muscular, our myostatin genes are not very good. And so no matter how you gym, I do exercises almost every morning, but I never get to add any bulk. It's very difficult. But there's some other guys that don't even do exercises because they have very good. The myostatin genes has been activated. They just have muscles everywhere, and now they are Mr. World and all. And we can't be Mr. World. So we can do that with PCO. You can deactivate the gene. So this is a common attraction, and I'm very serious about this.
Also, yeah, I'll take this time again to celebrate some of our viewers. I see you, Rebecca. I see you, Justina Onubi. I see you, Calvin. Thank you all for joining and many more. Yeah, if I don't mention your name, just know that we celebrate you at Alps Hospitals. Thank you for joining. So we have Martha asking the question. Please, is it possible for someone who has given birth before to have PCOS? And what could be the cause?
Exactly. So, this is a very tricky question, but yes, it's possible. Maybe when she got pregnant first and given birth, the PCO situation has not been exposed to a lot of risky
Risk factors.
factors to make it get fully manifested. You know, so she got pregnant. It's also possible after that first birth, she had added a lot of weight. Yes. And weight increases your estrogen, increases hormone abnormality, decreases the quality of eggs. Weight on its own, without PCO, decreases the quality of your eggs and make the eggs have abnormal mitotic spindle. Well, this is my research in London anyway.
Wow.
Abnormal mitotic spindle and make the eggs difficult to bring about pregnancies.
Wow.
So what we see with most women is that when they get married, they are slim. And then they suddenly get pregnant. And then they add this weight that they never shared. And another attempt at pregnancy starts. So for those who are genetically predisposed to having PCO already, the weight and the lifestyle changes following pregnancy and childbirth may trigger it. So then the PCO becomes manifested, and then they may not get pregnant. I'm talking with respect to PCO, but there are other reasons why a woman may not get pregnant after the first birth. It could be related to the complication of the delivery. Maybe she had a lot of bleeding, a lot of problem in the uterine cavity or infection in the uterine lining that had given adhesion. And then if you are wired to think like a gynecologist that I am, then you can trace it to whichever end you want to trace it. But yes, PCO can now manifest after your first childbirth.
So I hope that answers your question, Martha. So this is Hawa making a comment as well, that with secondary infertility, one of our relatives conceived at Alps Hospitals this month through IVF. Oh wow, congratulations to your relative. We really hope that goes well, and we pray God sees her through to term.
That's
and
fine.
Baby and mother are doing okay. And then Rebecca is also saying, thank you, Alps Hospitals. We shall deal with infertility this year in Jesus' name. Well, amen.
Amen.
Amen to your prayer, Rebecca. Dear viewers, it's been really amazing having you engage us today. Thank you so much, everyone, for staying tuned. We see all of you, and we're glad you joined. Continue to stay tuned while we get a wrap-up comment from Dr. Ken. Do you have something to tell them as we wrap up?
Yes, even though I speak about PCO, I'm scared of PCO. I'm actually scared of PCO, but of course, it's a life that we have to live. We have to support people with this condition. We'll do our best to bring the best of care to people and hope that they will put themselves together to accept the care that will be good when you go. Yeah, some of the cares are easy, some are difficult, and some can actually be is it cost effective or costly?
Yeah.
Maybe, and occasionally, of course, you should negotiate with the doctor to make the best choice for your fertility care. Don't be too stubborn.
Yeah, so dear viewers, if you've been diagnosed with PCOS, it's not the end of the world. It's just for you to seek help if you feel you fall into the categories that would want to try to conceive, or you're already showing some of the symptoms Dr. Ken had mentioned. Seek help early and from a good place like Alps Hospital, just where you can guarantee that you know what you're getting from them. Alps and the Alps team, you can always count on them. One of the best in the world, I can tell you. Yeah. So, dear viewers, once again, thank you so much for staying tuned. Even though Martha is dropping a question, Dr. Ken, should we take her question or we'll just okay? So let's just take a question, Martha, before we wrap up. My son is 3 years old. That's Martha speaking, and she didn't have any issues and she conceived on her own without any medications, but now diagnosed with PCOS. Well, this is her just making a comment, and so it means that, like Dr. Kenneth explained, you could still have PCOS. Maybe now you have symptoms that have triggered it from your first delivery
Exactly.
and all. Well, we really hope you're able to get more kids soon. Martha, thank you for being active in this chat today.
Try and have like 4 kids.
Oh yeah. So we wish you the best in your fertility journey and assistive management for PCOS. Thank you so much, dear viewers. Continue to stay tuned. If you have further questions, you keep dropping them, or you could send a message to the number being displayed on the screen, and we'll definitely attend to them appropriately. Once again, thanks for joining. Have a lovely evening. Bye.